All right, Shay, take it away.
Thank you, Sean. Welcome, everybody. We're so thrilled to be here. Welcome to We Need You, Calling All Self-Advocates, Medicaid Advocacy in 2025. Now, before we begin, I'd like to give a special shout out to Miss Stacy and Miss Charlotte Woodward for inviting us to come here tonight to share this information with all of you. All right, next slide, please. So as I said, welcome to our training, Medicaid Advocacy, Self-Advocacy Training. And now I would like to pass it to Charlotte Woodward, who will introduce our team. Charlotte?
Thank you all for joining this very important meeting. And I would like to give a little bit of a background of our presenters. Shay Ruff is a Radford University graduate with her Bachelor of Social Work. She has 11 years of professional experience in various roles in her field. She is a self-advocate for 20 years and believes that people with disabilities should have equal access to the supports they need to create the lives they want to live. She is living and thriving with cerebral palsy for 41 years and has many years of lived experience. She has the desire to help everyone live the life they want. Jessie Monroe, born 46 years ago with a physical disability called arthrogryposis, that constricts the movements of his joints and muscles. Since 2017, he's lived independently on his own in an apartment in Norfolk, Virginia, with services from his DD Medicaid waiver. He is an advocate both statewide and locally for people with disabilities. He works as a self-advocate coach and trainer for the Arc of Virginia as a member of a state self-advocacy alliance called A Life Like Yours. He's also a member of a local advocacy group called Our Voices. He is also passionate on issues like increasing Medicaid waiver slots for those with developmental disabilities and raising the reimbursement rates for providers of services. Sean is a native of Richmond, Virginia. He's very passionate about advocating for disability rights, and not just in Virginia. He also does work on the federal level too, while also working to educate elected officials on issues important to the disability community. He has served on several nonprofit boards in many different capacities over the years. He is a graduate of Partners in Policy Making and the Virginia Lend, and is a part of the Virginia Lend program. He's a certified peer mentor and is now a certified tech mentor. He's also a former co-chair of the A Life Like Yours Self-Advocacy Alliance and the logistics lead with the Arc of Virginia. In his role as an advocate, his motto is, people with disabilities have many different talents and abilities. Give us a chance and we will show you all that we can do. Thank you, Shay, Jesse, and Sean, for joining us. And now I would like to pass it over to them to continue their presentation.
Thank you, Charlotte. Next slide, please. Okay, so the Ally Alliance is we, as an alliance, work in solidarity to ensure that people with intellectual and developmental disabilities have a life like yours, and that their voices are the driving force affecting change in Virginia. Next slide, please. Okay, we are better together. Some of the material in this presentation comes from the ARC of the United States. As self-advocates, we are thankful to the ARC for making this information available to use for training. Okay, so now I'm going to go over a little bit about what we're going to be discussing tonight for the agenda. Our welcome, quick meeting reminders, introductions, what is Medicaid, words from the ARC of the US, current threats to Medicaid, block grants, per capita caps, action today, and lastly, how we staying connected. Next slide, please. Okay, so before we begin our presentation, I want to go over a few quick meeting reminders. Let's be respectful to one another and keep ourselves on mute for our presentation. Please use the raising hand icon when you want to say something. Please say your name before speaking so we can be inclusive to all participants. Feel free to use the chat box during our meeting today to submit questions and comments. We will share questions, comments, and ideas at the end of our presentation. Next slide, please. And now I'd like to pass it off to my colleague and friend, Jesse Monroe. Jesse.
Thank you, Shay. So let's talk about what is Medicaid. Medicaid funding is a partnership between the federal government and the state to provide Medicaid benefits to people. It provides health insurance, which is inpatient and outpatient hospital stays, doctor's visits, laboratory and x-ray services, and prescription drugs or medicine. It also provides long-term care, which is home and community-based services, DD waivers, CCC plus waivers, and nursing home care. Let's learn more with a video from the ARC of the US.
All right. I know that the audio works on this video, but just let me know if you can actually see the video.
A base percentage of Medicaid costs through what's called the Federal Medical Assistance Percentage, or FMAP. This percentage varies by state. It depends on the state's average income levels. So wealthier states receive less federal funding, while poorer states receive more. This is typically between 50 and 80% of total Medicaid costs. States must pay the remaining portion of the Medicaid costs. And then the states use general state tax revenue to fund Medicaid. Others rely on provider taxes, hospital assessments, or other dedicated funds. But states have flexibility how they structure their Medicaid program, but they must follow the federal guidelines. The federal government sets broad rules for Medicaid. For example, required benefits and eligibility categories, but they're able to design their own program within those rules. So they can choose which optional benefits to provide, like respite care or dental services. They can add additional eligibility groups and different provider payment rates. So that's just a little bit about Medicaid. Now, why is Medicaid at risk? And here on this slide, you can see a big target, because we we now have a new president and Congress, and Republicans have a very small majority in both the House and Senate. But what we know is what we're hearing is that they're talking about priorities, and their priorities are to decrease the size of the federal government. They've also announced plans to extend or pass additional tax cuts. But to do this, without increasing the deficit, they need to find ways to pay for those tax cuts. The Budget Committee chairman released a whole list of spending cuts that they might use to pay for these tax cuts. So, and we know that a very large portion of those come from Medicaid. So we need to make sure that they understand how important Medicaid is, and that they get the message that cutting Medicaid for tax cuts is just wrong.
Now that you heard from our friends at the Arc of the US, we want to go over some of the current threats to Medicaid. The US House of Representatives has proposed to cut $800 billion from Medicaid over the next decade. These are common ways that Medicaid can be cut: through block grants, per capita caps, reducing the matching rate, and work requirements. For the purposes of our time this evening, we are going to look at two tonight: block grants and per capita caps. You might be asking yourself, what the heck is a Medicaid block grant? It's basically a sum of money from the federal government that helps states provide services to people with disabilities. Block grants give states a fixed amount of money to provide services, and this funding doesn't increase even when the need increases. So we'd like to ask you guys a question. What do you use Medicaid for in your life?
Well, it helps pay for my medication.
Mm-hmm. Anybody else?
Oh, there's something in the chat.
I'll
It's,
read that.
okay, Sean, do you want to read that?
Yeah, I can.
Okay.
It's Sarah says, we use Medicaid for all of our daughters' needs: therapies, doctor visits, surgeries, etc. I think Jesse can speak to some of those, like doctor visits and medications and such.
Yes, and I use Medicaid for all that. Yes.
And Shay, what about you?
Same thing, wheelchair equipment, what they call medical durable equipment, which is my wheelchairs, doctor's visits, life-saving surgery, all sorts of things.
All right, anybody else care to answer before we move on to our next slide? Well, feel free to keep putting your answers in the chat and we'll come back to them at the end. But now I'm going to pass things back over to my colleague, Mr. Jesse Monroe, who's going to talk about, no, I was going to say this is me. I take that back. Sorry.
Mhm.
But the potential impacts of block grants are the following: reduced benefits. Block grants limit the amount of money states can spend on programs, so states may have to cut benefits or eligibility, which means that people that are on the waiver might not be on it anymore, or people that are on the waiting list will no longer be there. Waiting lists. States may put people on waiting lists for benefits or deny benefits outright. They also reduce the reimbursement rate. Reducing the reimbursement rates for healthcare providers, which can make it harder to get care. And we know as people with disabilities, it's hard enough to get care sometimes now. But now I would like to turn things over to my friend and colleague, Jesse Monroe, who's going to talk to you about us. What the heck are per capita caps? Take it away, Jesse.
Thank you, Sean. So what are per capita caps? Per capita caps are limits that the federal government could set on the amount of it spends per person using Medicaid. If the care that person needs goes over the limit, the state would have to pay for the extra cost. Here's the potential impacts of per capita caps. Reduced benefits. States might cut benefits that aren't federally required, like dental care and prescription drugs. Reduce access to care. States might reduce payments to hospitals and physicians, which could lead to being providers leaving the Medicaid market. Narrowed eligibility. States might narrow eligibility to control costs, which could eliminate coverage for people with high cost needs. And now we're going to show another video.
And this video is talking about how you can get involved. And if you have any trouble hearing the video, you might need to turn the volume up on your computer, as this video is as loud as we could get it.
It is time to learn about how you can get involved in making a difference. Claire, take it away.
Thank you, Yvette. And once again, a huge thank you to all of you. We have almost 1,500 people on this call. That is incredible because we need your help. I'm Claire Manning. I'm our Senior Director of Advocacy and Mobilization. I am a white woman. I have blonde hair. Today I'm wearing a green sweater. I know that we can protect Medicaid if we all work together. And there are 3 things that we need everyone to do so that we ensure that all members of Congress understand how important Medicaid is for people with disabilities and their families across the country. Number 1, act now. I'm going to tell you how in just a second. 2, stay updated because things are moving really quickly. And 3, there is power in numbers. We need to get other people involved. So first up, act now. The number 1 thing that we need everyone to do, basically, get off this call when it's over and contact your members of Congress and tell them what Medicaid means to you or your family. This might sound a little bit scary if you've never done it before, but it's really important to remember that your members of Congress work for you. They represent you and they need to know what's important in your life. That is critical. Now, I'm going to go over several ways to take action, and don't worry about the links. Like I said earlier, they're all in the webinar here. They're all on the slides, but we will also put them out on social media, and you will get a copy of all of this by email probably in the next 12 hours. So don't worry about scribbling them down really quick. So first up, the arc.org/action. This is our action center where you can go type in your address and really quickly and easily get connected with your members of Congress. You can send an email, do a tweet, which is really great because it's public. You can make a phone call. I suggest that you do all 3. That's wonderful. Here on this slide, we have a picture of our action center. It includes some families, some children. And when you contact your members of Congress, share your story with them. Tell them, kind of give the examples, some of the examples that Kim provided about really what Medicaid means for you, how it impacts your life, really educate them. We also have a toolkit to help you kind of craft what that could look like with some best practices on sharing your stories with members of Congress. And if you're able, in DC in April, we are going to be hosting the Disability Policy Seminar. It's a several-day conference that we do every year with several other disability organizations. And we include the last day of the conference is on Capitol Hill, where participants will be able to meet directly with their members of Congress and staff, kind of take the fight right to them and talk about the issues that are important in our lives. Now, this next slide includes a picture of advocates from the ARC wearing orange t-shirts that say disability rights are human rights. And what I want to share here is that if you haven't already, I recommend that you connect with your state and local chapters of the ARC, because as Kim said, Medicaid is a federal and state program, so these impacts are going to be happening on the state level as well. So it's really important that there's state organizing and advocacy happening. If you're a person with a disability, I highly recommend that you consider joining our National Council of Self-Advocates. Our National Council of Self-Advocates meets monthly, where they do advocacy training, talk about different current issues and how to get involved, and it is co-hosted by Yvette.
All right. Now that you heard from our lovely friends at the ARC of the US on how you can get involved, we're going to walk you through some things that you can do right now, as soon right now. Let's do it together. The first thing is you can write Congress with the ARC of the US, which I'm going to show you how to do that. You can call Congress. We're going to show you how to do that too. We're also going to talk to you about how you can stay connected to the ARC of the US to see what's going on, policy related, same thing with the ARC of Virginia, and also how you can connect with the Ally Alliance. So you can stay up to date on what we're doing when we have meetings and trainings and all this other stuff. So to write your member of Congress, I'm going to click on a link here. And you'll go to this page, and it's the Arts Action Center. And what you can see is you'll see a whole bunch of stuff, but you're going to click on this one that says Tell Congress Medicaid is a lifeline for people with disabilities. I'm going to click on the Take Action button. And you should see a page that looks just like this. It's going to tell you some stuff here. And then all you literally have to do is fill in your information. And they do have a pre-filled in little template, but if you want to add a little bit to make it your own, you can do that. And all you do is click send email. And if you keep these two boxes checked, then that will allow you to stay connected with the ARC of the US whenever they have action alerts. Go. And now I'm going to pass things over to my friend and colleague, Jesse Monroe, who's going to talk to you about calling your legislators and tell you about a really cool template we have that'll help you in that. Jesse?
You, Sean. So if you want to call and contact your congressman, you want to use a script. That way you know what you're to say and can get to the point. So I'll run through that. So here's a phone script or a one pager, we call them, for Medicaid Advocacy. We'll say my name is, put your name. I live in city, you say state, and I use Medicaid for. And here you just describe what kind of things you use Medicaid for, whether that's waiver or health insurance. Then you write, I'm asking you to please oppose any proposals that would reduce Medicaid funding, including block grants and home and home-based services. And then you write, if Medicaid were cut, my life would change because, and just talk about some of how your life would be affected if they cut Medicaid. And then you say, I hope my story persuades you to oppose any plans that would cut Medicaid funding, such as block grants for a person spending limits, reducing the federal match, or taking away extra funding for home and community services. And then you write, thank you for listening to me. We need your help and support. And you just do that. It's very easy, and you can send it to your representative at the end. To do that, you can click on this link here, and here's the U.S. Capitol switchboard phone number. And you want to contact U.S. senators for Virginia, they're Tim Kaine and Mark Warner, so you can contact them as well.
If you want to find out who represents you in the House, you click on the link I just did, and in my case, I'm going to put in my zip code. And when I click on Find Your Rep by zip code, it's going to show that Rob Whitman and Jennifer McClellan represent me in my zip code. But if I want to go even further and find out who represents me at my address, I'll put in my address and put Find Your Rep by address. And as you can see, that based on my address, Jennifer McClellan is the one that I would want to contact in the House to tell her to oppose the Medicaid cuts. And our senators for Virginia are Tim Kaine and Mark Warner. And now we're going to take you to step 3, which is how to stay connected. To stay connected with the Arc of Virginia, and all the links you see me clicking on will be emailed to you guys after this presentation. So you'll click on this link, which will take you to the Arc of Virginia's Action Alert page. And by filling in this information, you're going to tell the Arc of Virginia that, hey, I want to stay informed. And down here, you're going to decide, do you want just advocacy and action alerts, news and information, or both? I kind of like to do both because I want to know everything the Arc is doing. And then you have the option to tell them, do you want your stuff by email or just by text? Because they can do both. And then you would click on sign up. To sign up for the Arc of the US Action Alerts, you click on the link that I'm clicking on now. And you're going to go down to about the middle of the page where it says, sign up for email updates. And you'll put your email address, first, last name, and zip code. And then click on sign up. And that's all you have to do to stay connected to the Arc of Virginia for advocacy and the Arc of the US for advocacy. Now we've come to another way that you can stay in touch. Are you a person with a disability in Virginia? We would love for you to join the Ally Alliance. To join the Ally Alliance, you can either scan the QR code you see up here on the right, on the left, or you can click on this link, which we will provide. I'll take you to our page so you can see what it looks like. This is our Alliance page, and all we ask is if you come to visit our page, that you just give it a like or a follow, and you'll know exactly what the Alliance is doing all throughout the month. And if you think you might want to join the Alliance, which we're always looking for new members, you can scan the QR code down here in the bottom right, or you can click on the link, and it'll take you to this Google form. And all you have to do is just fill the form out and submit the form, and then someone will be in contact with you to get you ready to be a part of the Ally Alliance. And Shay, was this you?
Yes. Thanks, Sean, for that great information. And please, 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 we're always looking for new members and we would love to have you. So now I'm going to talk about how you can stay updated with everything that we're doing with the Ally Alliance, the Arc of Virginia, and the Arc of the US. At the bottom of this slide, you'll see a QR code for the Ally Alliance and a QR code for the Arc of Virginia and a QR code to our our partners, the ARC of the US. Just scan that and you'll get information on how to stay updated with everything we're doing. Now, you will, at the end of our training tonight, you will receive a survey from us. And what we're asking is that if you guys would take time to fill out this survey and just let us know how this training was and how it was for you. Your information, by filling out this survey, guys, it is anonymous, but you will be helping us make sure that we're providing pertinent information and how to better do trainings and get some ideas on what future trainings can be. So if you can see there, you have a QR code you can scan. And Sean, I believe the Medicaid call to action survey is there as well. And as we've said before, all links and surveys, post surveys will be sent to you guys within the next 24 hours. And we would appreciate all feedback. Thank you so much. Now, we'd like to take questions now. Does anyone have any questions? Okay. Any
Yeah,
questions? Any questions?
And while we wait on that, when you heard in that second video about 1,500 people, when that webinar first aired, they had 1,500 people join, and they had to shut the webinar. They had to shut registrations down because they had so many people that wanted to be on that.
Right.
That's just amazing to see that many people come out.
I
Sharon,
get,
we
oh.
have a question that says, is that webinar available? Do we have that?
Yes, the full webinar should be available on you can check the ARC of the US's Facebook page. You also can check the ARC of the US's YouTube page, but I will make sure that when I email Charlotte and Stacy all these links, that we try and include a link to where that webinar is located if we can find it. Because it's a more full and formal webinar, if that makes sense.
That would
You're
be great.
welcome. You're welcome. We always want to make sure we have the most updated information, and any information that we have, we would love to share it with you.
Any other questions?
Okay, everybody. Well, thank you so much for attending our training tonight. Please feel free to reach out to us if we'd love to come back and share more training opportunities with you. And please fill out that survey at the end. And we appreciate the feedback. And again, I want to extend on behalf of our team, we want to thank Stacy and Miss Charlotte Woodward for inviting us to give this training tonight.
Well,
Thank you
Thank
guys
you
so much.
for your time. It was very a wonderful presentation with lots of information.
And thanks for those final words, Stacy. I see there are a few people in the chat that I said thank you for this wonderful presentation, and I'd also like to thank my friends, my fellow Alliance, my fellow Ally Alliance members, Shay, Jesse, and Sean, who are wonderful advocates. Thank you for this fabulous presentation.
Thank you.
I hope you enjoyed this presentation.
Thank you,
Yes.
Charlotte.
So much.
Yes.
All right. I think you can stop recording now.